Hello everybody. I'm here again and today the topic of discussion will be rubella, which is also known as German measles. The term rubella is derived from Latin term which means little red. Rubella is also known as German measles or 3-day measles. 3-day measles because the rash of rubella is lasting only for 3 days. This is another acute childhood viral infection having a worldwide distribution. The epidemics of rubella is noticed every 6 to 8 years interval. The agent causing rubella is rubella virus, which is a RNA virus belonging to Toga virus family. There is only one antigenic type of this virus. And the source of infection for rubella is nasopharyngeal secretion, blood, CSF, urine, feces. And the infants with congenital rubella syndrome, that is the babies infected, getting infection from the mother, they shed virus for 18 months, so they are also infective. Come to the host factor. The common age group for rubella is 3 to 10 years, that means children age group. But any age is at risk if they are unvaccinated. And this affects both sex. Many times people think rubella is occurring only in the females, but that is not correct. It is occurring in both sex. The humans are only known host for this disease. The immunity with the first attack is lifelong. So if you get a rubella, you get a lifelong immunity. And for the children, they get a protection from maternal antibody. They are protected for 6 to 9 months of age via the maternal antibody. The environmental factors for this disease is it has a seasonal pattern mainly seen in late winter and early spring, where there is overcrowding and then poor housing conditions is seen to have more rubella. The incubation period for rubella is 2 to 3 weeks with a peak of 18 days. The infectious period is 1 week before and 1 week after the rash, but this is a less communicable disease when compared to other viral fever with the rash. But it has a clinical significance because this virus is associated with the teratogenic effects leading to congenital rubella syndrome. So if a pregnant lady is infected with rubella, there is high chance that the baby will be born with multiple congenital defects. That is known as congenital rubella syndrome. The transmission is via respiratory droplets while sneezing, coughing, talking. These air droplets are inhaled. Number 2 way of transmission is direct contact, that is by touching surfaces which are contaminated with the virus. So this is person to person contact transmission. And then third is the vertical transmission that is occurring through the placenta, that is from the mother to the baby. Now come to the clinical feature of rubella. 50 to 60% cases they remain asymptomatic, and then many they just have a mild and variable symptoms which goes unnoticed. Rubella has stages of clinical presentation. So first one is prodromal stage, where there is coryza, sore throat, low grade fever, and within 24 hours of these symptoms the rash starts, and rash is the main feature. There is lymphadenopathy, mainly suboccipital, posterior auricular and anterior cervical lymph nodes are involved and they are tender. So there is a tender lymphadenopathy from 7 days before rash, and then it is persisting till 10 to 14 days after rash. Then comes the eruptive phase or the rash stage. So rash is appearing within 24 hours of the fever. First this rash appears on the face, then it spreads centrifugally. So face, trunk, extremities that way. The rash is minute, discrete, pinkish in color, maculopapular, but not confluent like measles rash. It spreads and then it clears very fast also. So within 3 days the rash disappears. 20% cases with rubella, they have enantheme, that is appearance of the discrete rose spot on soft palate. So similar type of rash is seen in the soft palate. This is known as Forsheimer spots, and this is pathognomic of rubella. During the eruptive stage, there is rash which begins on the face on the first day. Second day, the rash becomes pinpoint, and then third day they disappear. And many times adult population, they may have polyarthritis also. So this is rubella rash. Come to diagnosis. Diagnosis can be done by isolation of virus and by serological test. Serological tests are more widespreadly done as the facilities are available. Here, rubella specific IgM antibody, if it is present, this indicates acute or recent infection. And another you can see is rubella specific IgG antibodies, which indicates past infection or vaccination. But if you get a 4-fold rise in the rubella IgG antibody titer in paired sera, that means between acute phase you take one sample and convalescent phase you take another sample. So that will be 2 to 3 weeks apart. So during this time, if the titer of the IgG antibody rises by 4-fold, this is more diagnostic for rubella. Virus detection is done by RT-PCR for rubella RNA in the blood sample, throat and nasal swabs, and also done in the urine sample. Treatment is symptomatic. There is no specific antiviral drug for rubella, so just a symptomatic management is done. Complications of rubella is rare, not very commonly seen, but these are the few complications which might be seen: arthralgia, arthritis, encephalitis, polyneuritis, thrombocytopenic purpura, progressive rubella panencephalitis, myocarditis, and then the congenital rubella syndrome. This is the bad one, and we are more concerned about the congenital rubella syndrome, because with this syndrome a baby is born with the multiple congenital defects. So let's see what is congenital rubella syndrome is. This is infants born with defects secondary to intrauterine infection. So if the mother is infected during the pregnancy and the defects seen in the newborn is known as congenital rubella syndrome. Or sometimes infants develop the sign symptom of the intrauterine infection after birth. At birth they look normal, but after some time they start developing the sign symptom of this congenital rubella syndrome. So both are considered as a congenital rubella syndrome. So here there is inhibition of the cell division, which leads to congenital malformations, which is multiple, and the baby is born intrauterine growth restricted, IUGR, or low birth weight. The risk of congenital defects depends upon the time of pregnancy when the mother is getting infection. So gestation age is very important. So gestation age at which maternal infection occurs determines the extent of infection or the malformation effects occurring in the fetus. So if the mother is having rubella infection in the first trimester of a pregnancy, 90% cases of fetus are born with the malformations of the multiple organs. 15 to 16 weeks, if the mother is infected, then 25% babies or the fetus will be born have a multiple congenital defects. More than 16 weeks, if the mother is infected, then there is no congenital defects. So first trimester, if the mother is infected, 10% cases there is abortion, 4% cases are born stillbirth, and the remaining are born with the multiple organ defects. And the main defects are showing a classical triad of sensory neural deafness, cataract, and patent ductus arteriosus. So heart, eyes, and ears. So these three are mainly affected, and usually maximum babies they have this classical triad. Early second trimester only deafness is seen, and 16 weeks onwards there is no major congenital malformations. During the active infection at birth, a baby may have a hemolytic anemia with the anemia and jaundice, thrombocytopenic purpura with the petechial rashes. There are skin lesions known as the blueberry muffins. They may have pneumonia, they may have hepatitis. Encephalitis and meningoencephalitis is seen in 10 to 20% of cases. So ocular abnormalities are seen in 43% cases. So here congenital cataract is noticed, infantile glaucoma, microphthalmia, pigmentary retinopathy, salt and pepper retinopathy is seen. And 58% cases there is sensory neural hearing loss. 50% cases there is a congenital heart diseases, main is patent ductus arteriosus, and there may be pulmonary artery stenosis also. And other features are myocarditis, microcephaly, cerebral palsy later in life, mentally retarded, and then there is delayed milestones. Baby is born low birth weight, so that is IUGR, intrauterine growth restriction, and then they may have hepatosplenomegaly. So these are the various organ involvement and the ones showing the salt and pepper retinopathy. Diagnosis of the congenital rubella is by classical triad, and then different organs involved you can find out, and you can do serology, that is rubella specific IgM antibodies in serum after birth, and if there is a persistence of IgG antibodies after 6 months, and this also indicates congenital rubella syndrome. And you can do virus isolation, that is RT-PCR for rubella RNA from urine, blood, nasopharynx and amniotic fluids. Treatment is just supportive, there is no definite treatment, and then treat the complications as it comes. And prevention, this is a very major step that can be taken to prevent rubella. So here you can do active immunization. For immunization, there is a live attenuated vaccine for rubella specifically, which is known as Wistar RA273 strain. Dose is 0.5 ml given subcutaneously, and this is giving immunity which is persisting for lifelong or at least 14 to 16 years. For adult women, this separate rubella vaccine is given, but for children aged 1 to 5 years, it is given in combination with the MMR vaccine, that is mumps, measles, rubella, and so in some countries measles and rubella vaccine is given, that is MR vaccine. So MMR vaccine is comprising of 3 components: measles, that is live attenuated strain of Edmonston-Jackrev measles virus propagated on human diploid cell culture, and mumps is L-Jackrev mumps virus propagated on chick embryo fibroblast cells, and Wistar vaccine, rubella vaccine, that is Wistar RA273 virus propagated on human diploid cell culture. So this is a combination vaccine available for children. Contraindication of the vaccination, this is a live vaccine, so during pregnancy you should not give, and then if you give the vaccine, avoid pregnancy for at least 3 months after vaccination. The strategy of vaccination is mainly protect the woman of childbearing age, that is 15 to 39 years, to prevent the teratogenic effects on the fetus if this mother becomes pregnant. And another is immunize all children aged 1 to 14 years to interrupt the transmission of the virus. That is the strategy of virus vaccination. So vaccination is very important to prevent rubella and mainly to prevent the congenital rubella syndrome. Thank you. I'll come again with another viral illness in another class.